Hi everyone. Hope everyone is doing good, and I am glad that you found this session. Have a seat. We will get started. This is a session on narrative therapy. My name is Carmen Cancel. This is my first semester as a Master's of Social Work grad student. I have my undergrad from Mount Mary University in Milwaukee, Wisconsin, also in social work. And most of my experience has been in maternal and child health. So I've worked in the public health sector, the child protective service sector, um, and so that gives you a little idea as to what my background is. I have a little background in long term care. I've worked with traumatic brain injury residents as well as patients that are in a skilled nursing facility or a rehab center just to get stronger from recovery. So, the purpose of the presentation is to explain how narrative therapy can flourish the many strengths a family has to offer. So, as we know, you as a family, you guys have all the knowledge, all the education about your family. And so, this type of therapy just really brings that out. We will look at the positive outcomes of narrative therapy. And then we'll also discuss the genograms and ecomaps and how that relates to the family, which is pretty interesting. How does narrative therapy describe dysfunction? So, in one of the textbooks, which is by Nichols and Davis, he talks about family is encouraged to think of themselves as struggling against their problem. Um, so, basically, you have a problem, but you are struggling to get over that problem. The problem is not consuming you. It views the problem as separate from people and assumes people have many skills to overcome their problems. So it really takes the time to talk to the family and just really figure out what skills do you guys have to overcome your problem. Um, Something else that Nichols and Davis talks about is that narrative therapy rejects the idea that families are responsible for the problems of family members. So basically saying that even though you have a problem, it does not necessarily mean that it is a responsibility of the family. A lot of times we have problems because it's life, and so he really, narrative therapy really rejects the idea that the family is responsible for them. And then it also talks about avoiding judgment about what others think is normal. It really takes each individual family and just wants that family to feel empowered, and to not try to compare themselves to another family. How does narrative therapy describe functional therapy? Um, So it believes that all families are experts about their own life. So again, this is your life. These are your situations. These are things that are occurring to you. You know best about this. Narrative therapy uses past stories to come up with solutions for current problems or concerns. What has worked in the past? What didn't work in the past? Um, what can you think about now that you possibly didn't think about back then? So we use all of that to incorporate that into the narrative therapy. You're the spotlight. Families are the spotlight of the therapy. The therapist is actively listening, and they are just making sure that families are the ones that are most important at this moment. And narrative therapy helps the clients deconstruct unpredictable stories in order to reconstruct new and more productive ones. So we may have a situation where something did not work out, but guess what? Let's take that and let's turn it around and make it work in our favor. That's really what narrative therapy is about. And I'm sorry, guys, what it should say is, how does narrative therapy describe a functional family? I apologize for that. So here is a little bit. I kind of did a slide to kind of show you so you could see how a genogram and an ecomap relates to one another. Um, and, and, and so what you're going to see is that in a genogram, it traces the relationship patterns for up to at least 3 generations. So you will continuously see that. It's also created with symbols for genders and lines for family relationships. And so that's really important because you can see the connections and where things, are about. And then it can be used to identify repetitive patterns and hereditary tendencies. So that's really nice too. In an eco-map, it represents how systems play a role in an individual's life. It's created with different lines, so you may have curvy lines, thick lines, arrows, and I'm going to be showing you examples of this, guys, on the next slide. And the individual is at the center of the eco map, and the lines are represented for the systems. And so if we look here, you'll see how in the genogram you have where you would be at the bottom, and you would have who your parents were, who their parents were, and who their parents were, and so on. And in the eco map, in the middle, you're really the center of the focus. And so you write down all the systems that are in your life, and that's where you would use the curvy lines for maybe a relationship that is a little turbulent, or the thicker lines to show that that relationship is very strong. You may even have a dotted line to show like a distant relationship. And so this eco map doesn't necessarily show those different types of lines, but based on what I said, you can kind of get an idea as to, if you have a relationship with the church, how is that? Or if you have a relationship with your mother, with your father, you can really show how that relationship is based on the types of lines that you do. So if you guys ever have time to sit down and do either one of these, it's really, really nice. I would encourage you to do it, actually. It's really nice. So some of the key points that we talked about today is that, again, narrative therapy really believes that you are the expert of your own story. You are the one who can tell your story the best. Nobody else can do that for you. You are the center of the therapy. You are able to tell your story. You are the spotlight. It does not view the family as being the problem. You are fighting against that problem. The problem is not fighting against you. The therapist will continue to ask questions, and they will follow your lead. And that is how, as a family, you will come to a resolution of, whatever the problem is that you guys are facing. Because again, it takes it back to you are the expert and nobody else. You're able to explain to the therapist how you want to spend your time, what you want to talk about at the session. It really lets you guide the sessions. And lastly, it pays attention to your strengths. What makes your family awesome? What about your family is the best thing that there is? And again, because you are that expert in narrative therapy, it allows you to be able to express that and to talk about that. That was just a quick and easy version of what narrative therapy is about. I hope that I was able to point some things out to you that really got your attention, that you want to know more about. So this would be the perfect time to ask those questions, make those comments. What do you guys have? Okay, well, everybody wants to be shy right now, so and that's okay. That's okay. If you have any questions or concerns or comments, anything, I'll be available after the presentation. By all means, come talk to me, ask me about it. I would be more than happy to sit down with you and explain some of the questions that you may have. Again, thanks for joining me. And yeah, I'll stick around, guys. All right. Bye bye.